Turning living cells into reliable therapies is one of the greatest achievements in modern medicine. But delivering on that promise demands precision at every step of the process. In cell therapy development, preservation decisions shape the quality, potency, and scalability of every program, from the integrity of starting materials and the reliability of in-process samples to QC comparability and final product stability across the supply chain. If you are challenged with cell types like NK cells and iPSCs, applying standard approaches often fall short. For processes built on fresh material, qualifying a frozen format later in development is a milestone that demands rigorous performance data, careful planning, and significant investment. Whether your challenge is to improve viability or consistency, reducing DMSO concentration in the final product, or scaling up in a different format, the development process requires the same disciplined, data-driven approach as for any other critical process parameter. At the Aby J. Mathew Center for Biopreservation Excellence, we work alongside biopharma and biotech teams from preclinical and IND-enabling studies through clinical and commercial manufacturing, developing tailored, scalable strategies across cell processing, formulation, and cryopreservation. Our approach is product agnostic because the right solution is the one that works for your process, your cells, and your patients. Because every workflow decision carries weight beyond the lab.